a warm greeting and welcome to all of you for your interest in this subject. As you know, we are hosting or sharing this program on the occasion of the World Psoriasis Day, which is actually on the 29th of October every year. But we thought that since Saturday is the next one, so let's have it today for a better participation from your end as well. So friends, why we are doing this program? Since the common subject that is binding us is psoriasis, the aim is how to approach this so-called incurable disease, that is psoriasis. Okay, so let me be very open from the beginning itself that psoriasis was my own journey, and myself being a psoriatic, gone through it over a period of years, and now I can confidently say that psoriasis can be cured. Okay, well, it's not 100% statement for 100% people, because nothing in life is 100%, nothing. Even love is not 100%, isn't it? Right? So here also, but the success rate is much more than what anybody can believe in, much more than anybody can believe in, with something so simple, so basic as vitamin D. It is so basic that we take it for granted, huh, friends? And in today's time, vitamin D has become a deficiency at the level of a global pandemic. In fact, the deficiency of vitamin D is a pandemic much before the present prevailing COVID-19 pandemic, okay? So we are going through a different time, and well, psoriasis is really multiplying. It is one of those autoimmune disorders which is there, and we never thought that so many people have psoriasis, right? And the incidence is pretty high. So the focus of today is to bring that awareness that, friends, there is something beyond steroids. There is something beyond the commonly prescribed immunosuppressive therapy. And having that notion in mind that, oh, once a psoriatic, always a psoriatic, hey, we can erase it out. And we can give a fair try to this method of treating it, which is scientific, safe, and effective, right? And it's not only going to help us with our psoriasis, but other systems of the body too, because vitamin D is needed by other organs also. So with this little background, let me share the program. I'm going to speak to you first on vitamin D, as you have already guessed. And then I have my very dear friend, Dr. Mili Shah from Mumbai, who is the president of the Ozone Forum of India. Mili, you'll be, let me try to see if I can, there. So here we have Dr. Mili Shah from Mumbai, and she heads the Ozone Forum of India. And she's another very passionate person, and she's my teacher too. And we have been great friends, and we teach each other actually. And so she's going to share with you how ozone therapy is a powerful tool to managing psoriasis more completely, more holistically. It will be great if vitamin D and ozone therapy can be advocated together. But our aim is to share the principles of each individually. If not one, the other is there. You know, we have to be open to both. So thank you, Mili. And I think we'll start now. Should we start? I'll start my presentation. Okay, thanks. Mayur, can you get me on the screen, please? So I'll do my screen sharing. So friends, before I begin, yes, I'm sure you'll have many questions throughout the presentation. So we have actually sort of, the question things we'll start later, because even if your questions come in between, you know, it's very difficult to answer them as we continue sharing what we want to share today to build up this awareness, okay? So we will definitely have a Q&A section in the end where you will be typing your questions in the chat, and we'll try our best to answer them, all right? And since this program is a general program, and at the same time, we have many doctors also who are participating in this program. So there's a warm welcome for all of you. At the same time, doctor friends, doctor colleagues, many of our, let's call them tricky questions, or the questions which are purely based on, say, medical fundas and science, We would love to answer them, but maybe not on this forum, where we have people who are patients, who are suffering from psoriasis, who are not from the medical background. So let's kindly keep the questions limited. What would be applicable to psoriatics, right? And with that little small request, I'm going to now start my screen sharing. The aim is to share maximum and minimum time and make it as crisp and as reachable to you all as possible. So just give me a second. I will start my screen sharing. Mayur, can I request you to please?
Yeah. Yes. So your screen has been shared, ma'am. You can just open the PowerPoint now.
Okay, but I'm not able to minimize the screen. Hold on.
So just click on screen share again.
Okay.
And choose the PowerPoint. Yeah.
Yeah, it's coming. Yeah.
Yes.
Can see it?
Yes, we can.
All right, thank you. So the binding factor today is this stubborn skin disorder. The word is stubborn. Yeah, it is very irritating, itchy, scaly, frustrating, because it not only gives these symptoms, but it also affects our attitude towards ourselves and how people look at us. And it really becomes very embarrassing and a harassing problem to go through. So friends, let's know some vital stats about psoriasis. Yeah. So many patients throughout the world. Can you imagine 125 million people over the globe? And in India alone, 2.6 crore people have various manifestations of psoriasis. And friends, this talk, this presentation also includes people with other autoimmune skin disorders like eczema, urticaria, but we'll be using the word predominantly psoriasis. So it is a systemic, means it involves the whole body. It seems to be present only on the skin, but the root cause is from inside. Our immune cells, our gut, they all play a role, and it produces an inflammation all over the body actually. So it's a systemic inflammatory disease. So definitely, if we have to treat it, the treatment has to be of the whole body, from inside out, and not just the skin out, okay? So being a systemic inflammatory disease, the reason is an overactive immune system, which is attacking us, which is targeting our own skin cells, okay? Now what happens in this condition? The production of the skin cells is hastened, okay? So this condition speeds up the life cycle of skin cells. As a result, the body has extra skin cells, and that's what form the itchy red patches on the skin, okay? And 30% of people who have psoriasis also have involvement of their joints, and that condition is called as psoriatic arthritis. There are triggers which, aggravate and even precipitate psoriasis, like infections, injury, stress, yes, stress, big one. And as you can see, vitamin D deficiency, and of course, some food factors and heavy alcohol consumption. Those who have psoriasis are at a higher risk of getting other metabolic diseases like type 2 diabetes, kidney issues, hypertension, and even Parkinson's disease. And as mentioned, it affects the quality of life so much that it can often lead to depression and various other emotional disturbances. The treatment options that are available at the present moment, commonly prescribed, used, are in the form of medications to suppress the hyperactive immune system, suppress it, and also mainly the effects of psoriasis. Reduce the age, reduce the scaling. So steroids are used, methotrexate, immunosuppressants, certain biological agents are used. These are the common conventional treatment methodologies, okay? And here I am, they are important when they are prescribed. So it's not that they are not good. Sometimes the skin problem is so bad that these medicines are needed, no doubt, but there is something we tend to ignore and we miss. And that is what I want to talk to you about, and that is vitamin D. Because it is not just a supplement the way we think. it has therapeutic potentials. It can treat psoriasis, eczema, urticaria, and not only this autoimmune disease category, but other autoimmune disorders also, like rheumatoid arthritis, lupus, multiple sclerosis, Sjogren's, and the list is a big one. So let's focus on the topic of today, and that is psoriasis. How does vitamin D play a role here? Well, number one, friends, as I just mentioned, is vitamin D deficiency, which is a global pandemic, and India is not spared. We may be wondering, hey, I come from a tropical country. We have enough sunlight. We do not have vitamin D deficiency. This statement would be true if we were living in 1950 or 1960. Friends, we are living in 2021. Let me tell you that vitamin D deficiency was not there in the past because we were farmers by profession in general. We were outdoor personalities, okay? And 90% of the vitamin D requirement was met by sweating in the sun, as you can see in this picture, right? You can see the moment you think of vitamin D, you think of open area, sunlight, people working outdoor. So 90% of vitamin D requirement was met this way, and 10% by limited food sources, okay? And 90% was enough to keep them healthy. How is the time today in 2021? We are scared of the sun, number one. Well, of course, there is a lot of pollution around us, which brings a different quality of sun rays. But at the same time, we are so scared, we are so paranoid that we literally cover ourselves in the sun, we wear sunscreens and all. So production of vitamin D in a healthy way, we have stopped. And we have seen that even those people who are exposed to sunlight in today's time, like, they are into outdoor sports or they are into marketing jobs, they have to go out, we find vitamin D deficiency, significant deficiency, even in those category of people. So it's no doubt a pandemic, and more than 95% of India already has vitamin D deficiency. Let us see, what am I talking? Is it true or not? These are the common vitamin D reports of today. Can you see here? Level is less than 3, less than 10. And the optimum level is how much? This lab says 20 to 50 nanogram. Friends, our ancestors had blood levels of 70 to 80. Okay, so in today's time with COVID coming in, it has nudged us. It has nudged humanity. It has shaken the medical profession, and the data says that it would be best to have vitamin D levels above 50, okay? Above 50 to be having a strong immune system. And where are we today? Less than 3, less than 10, 15, 20. It's shocking. So the question arises that what could be the causes of vitamin D deficiency? Well, friends, one, of course, lack of adequate exposure, the lack of vitamin D in diet. Why? Because there is no vitamin D definitely in the vegetarian world. It's devoid of it, okay? And even the non-vegetarian foods have very limited amount, and they alone cannot meet the requirement. Then the recommended daily allowance of vitamin D, which are being followed in many of the preparations, vitamins and all, those recommended dietary allowance were made in 90s, late 90s, when we were not so indoor people. Now today with the ACs coming in, with all indoor office facilities, the lockdowns and everything, these recommendations are not applicable to 2021 and beyond. Then we have problems in our gut, in our liver, in our kidneys, which are needed for a healthy metabolism of vitamin D inside. And then there's a widespread magnesium deficiency. We need magnesium as a friend to vitamin D, as a cofactor to vitamin D, to enhance and sort of activate it, all right? And then there are many chemicals around us, endocrine disruptors, which have sort of disrupted the metabolic pathways of vitamin D. And there are genetic alterations seen in VDR, or the vitamin D receptors of the body. So there are many, many reasons, but the conclusion is vitamin D deficiency is a pandemic. And the old thought that we need vitamin D to prevent rickets is like hitting only the tip of the iceberg. because vitamin D deficiency leads to not only bone problems, but a host of other problems, in fact, involving every organ of the body, skin, lungs, heart, brain, diabetes, you can see everything, even pregnancy-related complications, everything, we need a good amount of vitamin D in the body. And now we know that if the vitamin D levels are good, one can reduce the risk of flu, cancer, body pain, muscle aches, heart disease, depression, diabetes, autoimmune disorders, and of course, bone problems like osteoporosis and rickets. So 2021 and beyond, vitamin D is not an optional supplement. That, okay, I may take it, I will see, I don't need it. That attitude will not work. It is a non-negotiable cellular necessity because it makes up the health support system for us. So friends, quickly, just know vitamin D, whatever you get from the sun or whatever the supplement you're taking, has to undergo conversion in the liver, in the kidneys to finally become active. And once it is activated in the kidneys, it goes to various organs of the body, including the immunity cells, intestines, gut, bone, cancer cells, blood cells, brain, everywhere to bring out its effect. And how does it happen? Every cell of the body has got a receptor. Receptor is like the keyhole, every lock has a keyhole in which you fit a key, right? So you can imagine the vitamin D to be like key and the keyhole to be the receptor. So every cell of the body has the vitamin D receptor to which the vitamin D binds, and then all the effector functions are carried out, okay? It has functions affecting every cell of the body, which was not known in the past. And this is the picture of our cell, the basic unit of the body. There are millions of cells in the body. So cell has a nucleus, the center. And the vitamin D receptors, friends, are present on the nucleus. So can you imagine? Vitamin D has a role to affect even the nucleus where we have our genes, the genetic material. So vitamin D influences even the genetic expressions in the body. So it's not just a vitamin, it is actually now called as a hormone and a genetic modulator. It modulates the genes to our advantage. What does it mean? That if vitamin D deficiency is there, the genes will get modified to precipitate problems and diseases. And when vitamin D levels are adequate, the good genes are upgraded and the bad genes are suppressed. There are enough papers published, lots of publications, and today we know that healthy levels of vitamin D can prevent so many diseases, so many problems, and keep a check on their manifestation. And of course, you can see here the psoriasis, the talk of today. So friends, psoriasis, now we know it's an autoimmune condition where the immune system is targeting our own body. The immune system is ideally supposed to target only foreign bodies, if there are attackers from outside. But no, here what happens, the immune system probably is angry, probably it's upset, and it starts attacking our own cells. And friends, now I'm going to share the good news. See pictures of one of my clients, one of my patients, a psoriatic, and see now. And this is just by the use of proper vitamin D, right? No steroids, no methotrexate, nothing. So how does vitamin D do it? Interesting to know. But again, since it's a group where we are having more patients, but I'm sure you would like to know the mechanism, I'll try to make it as simple as can be, friends. So in our immune system, there are a variety of cells. We're not going to look here. We look only on the pink cells that you see here. Th1 cell is a category of immune response, Th2, Th17, and the T regulatory cells. So friends, let's know that Th17 is one big culprit for autoimmune disorders. All right. And so is the Th1. Let's try to understand it that way. And the Th2 is the antibody producing one, which sort of protects us, which is a response which is needed. And T regulatory cells, they help to, keep the immune response in balance. So what happens is, let me give you an example. Okay, let's suppose there's a foreign body attacking me and the body triggers an immune response against the foreign body. So there has to be a check by the T regulatory cells to stop my immune system when the foreign body has been dealt with. If the T regulatory cells are not working or they are less, that immune response of my body will continue. Although the foreign body is not there, but the immune system has been put on the fourth gear. All right. So now because it doesn't find the foreign body, it starts targeting our own self. So we need this T regulatory cell to put a check at the right time that, come on, immune system, stop. You need not be angry all the time. Let your anger be over once the foreign body is dealt with. So we need a good amount of T regulatory cells. I think this makes it clear. Now, friends, what does vitamin D do? You know, it is not an immunosuppressant like a steroid or other immunosuppressants, which will suppress all of them, the bad one and the good responses too. Vitamin D is intelligent. You can really call it a very intelligent molecule. No wonder it's a gift of sun god to humanity, right? It is not really made by human beings. Now we are able to replicate it in the form of supplements, which is a great thing to happen. But it comes from the sun, the original molecule. So what does vitamin D do? It's an immunomodulator. It says, I will suppress the bad one, but keep the good ones working better. So it suppresses the Th1, which we don't want, the Th17 also. Okay, we don't want this because the autoimmunity is happening because of these two. And it says, okay, see, these two are being suppressed, but it is keeping the antibody formation and the regulatory cells up-regulated. Intelligent molecule. We never thought about all these things, right? So vitamin D, it's a paper to show that it suppresses the Th17 response. So these are all, whatever I'm talking to you, friends, it's not made by me. I have learned it. This is science. This is proven. This is published. So autoimmune disorder like psoriasis occurs when, number one, of course, when there's a deficiency. Then two, there's something else. There are people whose deficiencies are met, but yet they have psoriasis. Because autoimmune disorders, they have something which is called as vitamin D resistance. Means due to some alterations in the genetics of the body, right? Family tendencies, the environmental toxins, stress, the genes get altered and the body develops a resistance to vitamin D. That we are taking vitamin D, but it's not working. So how to deal with it? And it is dealt with by giving more vitamin D than the general population. So when vitamin D is given to replace a deficiency for general population, then there's a full stop. But when it comes to psoriasis, we do take care of the deficiency, but we still give vitamin D. More than that, more than what we give to meet the deficiency, so that we can beat and combat this vitamin D resistance. Okay, so number one, yes, the same slide showing you how vitamin D deficiency is so common. So what should be the target level of vitamin D in the blood? 40 to 80 at least nanogram in the blood. In fact, the Endocrine Society recommends that even up to 100 levels are normal. Okay, this is one side of the story that yes, we all, general population, should target having blood levels at least in this range. And here is one paper to show you, just one, although there are many more, that there is vitamin D receptor polymorphism or that resistance that I'm talking to you in association with psoriasis. There is genetic polymorphism with other immune disorders also, like multiple sclerosis, lupus, and all of them. So this is a study which was done by my teacher, my guru, who taught me this methodology of dealing with autoimmune disorders with higher than usual doses of vitamin D. That's why we call it mega therapy. Vitamin D mega dose therapy, which is more than the regular ones. So this is another paper published where they gave higher than usual doses and saw positive clinical outcome in psoriasis more, and also in vitiligo, provided it was not a very long-standing one. And he is my teacher from whom I've learned, Dr. Coimbra from Sao Paulo, which is in Brazil, who is a neurologist, and he deals with patients of neurological autoimmune disorder called as multiple sclerosis using high doses of vitamin D, and the protocol has started being developed by him. And I was there in Brazil to learn from him. And we make a team of 150 doctors globally. And I feel very nice to share with you, but I am at the same time very humble to say it, that I am one of the doctors and I'm the only one from India trained into it. And it has now become my calling, because I see how it has not only helped me overcome my psoriasis, but yes, I'm getting nice results, encouraging results when I'm doing it on my patients, and not only psoriasis, but autoimmune disorders. So that's what brings us here today, to understand this methodology, which is called as the Coimbra protocol. So what are the tenets of it? Vitamin D has a potent immuno role, which you know. Autoimmunity is found to be associated with resistance to the effects of vitamin D due to the genetic change, which I told you. And that's why the individual requirement of vitamin D varies based on the degree of how much vitamin D resistance that individual has. This point is important to highlight here, because we doctors think that there is one fixed dose for psoriatic patients. It's not so, my dear colleagues. Every patient is different, and we have to assess it individually through certain tests. We have training programs for doctors where we are very happy to groom them into this method of treatment, and we decide based on certain reports, and I will briefly touch it now itself in a few minutes. So to compensate for the resistance, higher levels of vitamin D needed for treating autoimmune disorders. And friends, in this treatment method, vitamin D has to be given daily, right? Or more frequently for sure, rather than taking it commonly, like we take it once a month, once in 15 days, once a week. Well, this will not help, because half-life, or the life of vitamin D inside our immune cells, is 24 hours as compared to 15 days in the blood. So Dr. Friends, we need to give it on a regular basis. And how do we monitor it? Must be the question ringing in our mind. We monitor it by not only checking vitamin D levels, but also something called as PTH, or the parathyroid hormone. So when vitamin D levels are low, the PTH is high. And when vitamin D is given, the PTH comes down. So if somebody has been given vitamin D for treating psoriasis, we see that what is the difference happening in the PTH? How much is the drop in the PTH when X dose was given for a period of time? And based on that, we decide the next step. I'll show you just one example of one of my patients whose vitamin D levels was so low when she came, and see how high the PTH was. Upper limit is how much? 65 to 68. Hers was 287. So what does happen when PTH goes up? It is actually making our bones weak by pulling out the calcium from there. So this was a level, and when we started giving her vitamin D therapy, the PTH levels came down, and based on that, we decided the dose. So let that be for the doctor and the medical domain. I think for this general talk, this much information is enough. So we are guided by how much is the PTH inhibition by taking vitamin D, and that's how we decide. So if the PTH is not coming down, it means the person has a high level of resistance, and we need to give more vitamin D. Right? And at the same time, this also helps us measure the safety of the treatment protocol. There are certain micronutrients, or what does it mean? Other food items which have to be given to make the therapy effective, because again, these minerals are very low in 2021 due to various changes in our farming and in technology everywhere. So the minerals that are needed, magnesium, selenium, zinc, of course, B12 has to be corrected, omega-3 fatty acids, and some patients, not all, need a high dose of riboflavin or B2 separately. Yeah, that we all decide clinically and take the call. Well, friends, another big question that rings in our mind is, hey, how much vitamin D? Vitamin D is supposed to be toxic. Well, these things are ingrained in us so badly that we forget that the medicines that we take are much more toxic. Okay, please note. And this vitamin D toxicity is honestly not at all something to think of in today's time. Number one, we are so low in vitamin D. Number two, there is vitamin D resistance. So Vitamin D levels may go up, but it's not toxic. We monitor it. And friends, it's calcium that is toxic. High calcium, not really vitamin D. So when we are treating patients with vitamin D in higher than usual doses, we monitor their ionized calcium. And we do not allow the calcium to go above the upper limit. So practically, we usually stop the calcium supplement and rather give them magnesium supplement, because diet has enough calcium, which gets absorbed once vitamin D levels are brought into order. So vitamin D levels may go high, really high, even above 100, even above 150, but there'll be no toxicity provided the calcium levels are maintained in the lower, within the normal range and not above the upper limit. And PTH is the second guide. PTH still remains up. It is not completely or badly suppressed. Okay, so we are monitoring, we are guiding, and we see a lot of benefits. In fact, in the past, there are publications where vitamin D was used in high doses to treat tuberculosis, asthma, rheumatoid arthritis, and psoriasis too. So it is a treatment which should be monitored, friends. That is the point to be conveyed. Don't embark on this journey alone. You need a person to guide you, a trained doctor to guide you. And yes, of course, we are there. We have a team. So please don't worry about vitamin D toxicity at this juncture. You know, you can compare this with a person who's starving, okay? Starving with thirst. Matlab, bahut pyas hai, he is very, very thirsty and almost dying, but refuses to drink water because he thinks, I'm going to drown if I drink water. This is the situation of vitamin D toxicity. These are the words of a very popular vitamin D researcher, Dr. John Cannell, who says, worrying about vitamin D toxicity is like worrying about drowning when you are dying of thirst. Today, even this COVID episode we all are going through, one of the reasons is very low vitamin D levels globally, friends. We have used vitamin D not only to people who've come to us for prevention of COVID-19 disease, but also treating people who had COVID-19 disease. Of course, the doses were different. So some examples, and I will be very happy to share my own picture to you as the first one. This was one of my manifestations of the autoimmune condition when the skin had got literally charred. It was thought to be a sunburn and what all. I took all the treatments, covered myself from the sun using sunscreen every 2 hours of the day, did all the best therapies, but what really worked was vitamin D, which I took under the supervision of Dr. Coimbra and his team, overcame my problem, and I'm in front of you today. It has almost gone. And today, for the last 2 years or more, I have not used sunscreen even once, even when I go out in the hottest and the peakest time of the sun. And I've realized that if the inner body levels of vitamin D are good, sun cannot burn the skin, right? I repeat, if my inner vitamin D levels are good, sun cannot really burn the skin. The sun will burn the skin if internally my fort is weak, if internally I'm deficient in vitamin D, which can prevent not only psoriasis, but it also protects the skin. Some of my patients, right, who have benefited, this lady had psoriasis for years, along with other autoimmune disorders. She had literally given hope, thinking that this is never going to go. And you can see now how the skin has cleared off. We continued whatever treatment she was taking, right? She was on immunosuppressant. She was taking medication. We respect all that. We don't say that stop it immediately, no. And we started vitamin D, okay? Allowed the vitamin D levels to go up with the monitoring. And once things started getting better, we slowly tapered off the medicines that she was taking. And now she's on a very, very minimal dose of other medications for her other disorders. A gentleman, you can see such a bad skin autoimmune condition. You may not call it a typical psoriasis. This is an overlap of eczema, psoriasis, urticaria, undergoing all sorts of marks you can see, so you can understand phototherapy, everything going on. And look at the skin now. And he did not require much vitamin D. You know, friends, it doesn't mean that everybody will need high doses of vitamin D. We have seen that people respond even to moderate doses. Even normal corrections also help them out. Yeah, and it's very individual. Parallelly, as we give vitamin D therapy, I also treat the gut. I forgot to mention before, it's important to deal with the gut, which is a root of wrong things coming inside. There are, latent, subtle, chronic infections in the gut, which must be tackled. There are worms, there are parasites. You can say there are candida infections, fungal infections, which we also deal. And once the gut is dealt with by dealing with these infections, the probiotics work better. The good foods that we take, they work better. The vitamin D gets better absorbed. The other supplements get better absorbed. And the results are better than either of them alone. Okay, so gut becomes important, and we look forward to hearing to Millie how she deals with the gut using ozone. Another young boy, you can see how bad this problem was, and now it has completely cleared off. A gentleman with eczema, oozing, weeping eczema. The skin used to literally break off with fluid and discharge coming, and he's now absolutely clear in the skin. A farmer he required just basic vitamin D correction. Yeah, he's a farmer, and look at his hands and the problems clearing off. So friends, I can share with you more pictures, but that's enough. So don't feel despair. Don't lose hope. There is hope. It's worth a try. It's worth a try. You're not alone. There are lots of people. So let's get connected on this occasion of the World Psoriasis Day and see that we are giving better quality of life to so many who are suffering with various autoimmune disorders of the skin. So friends, in case you are interested and you want to know more, treatment comes later, we can share more information with you. You can please email to me on Param Health, please note it down, paramhealth@gmail.com, and you will be given the information, a video and everything, material, FAQs, go through it, read it, do your research, and if you are convinced, then only we will take it ahead. Okay, we are very happy to share all the information. So do email. If you want, you can also go on my website. That is, as you can see here, renumehdani.com, where we have some information for you. In fact, there are a lot of videos also on the website, which you can click on and listen to. And then we have a page on Facebook, which is called Psoriasis Can Be Cured. You can log in, you can join in us there as well. But if you are interested in treating or going ahead with your problem, do at least email us, because we'll be happy to share the information. Then it's your decision. Okay, no force to anyone. So with that, thank you very much for your patience to listen to me. And I'm now going to stop my screen sharing, and I will request Millie to take over and share her experience with the use of ozone in this treatment of psoriasis and other autoimmune conditions.
Thank you, Renu. That was amazing. And as usual, the presentation was so good that you get engrossed in knowing more and more about it. Thank you. I will be talking about ozone therapy with autoimmune conditions. That is a base. Of course, we will talk about, hold on, I'll start sharing. Okay. Yes. So we will be talking about psoriasis as this whole program was made for the World Psoriasis Day, but at the same time, we will be talking about other few autoimmune skin conditions. So it's called spectrum of psoriasis. Could be again autoimmune diseases like lichen planus, eczema, and many other things. So let us understand why do we need ozone therapy. As you saw that with only vitamin D and supplementation, you can treat psoriasis. But when you want to fast track the detox, when you want to improve your gut dysbiosis, when you want to improve your oxygenation and detoxification, along with replenishing vitamin D, ozone therapy can help you. If you don't do ozone therapy, it's not that, that you will not be cured only with vitamin D. it can be also dealt with psoriasis. But if you add ozone therapy, it's going to go little fast track. And I think Dr. Renu will also agree with that. So let us just go ahead with understanding why do we need to add adjuvant therapies and not only with one therapy at all. So no part can be understood without understanding the relationship. And we are here to promote integrated work. We don't compartmentalize the disease that the psoriasis is only skin. Um, no other treatment can be done. Only dermatologist or other, this is a holistic approach where we have to understand the patient as a whole. And as we go ahead, that we are what we eat, digest, absorb, metabolize, detoxify, and eliminate. Now, this is a very important slide because when you eat, you will know what is inflammatory food, what is non-inflammatory food, and that eat will further metabolize and will be absorbed. But that absorption, if it's not complete, then again that leads to inflammation. So it's a vicious circle which will keep going on, and that leads to the chronic disease. So when the diet is faulty, or it has a lot of junk food, or if it has a lot of environmental toxins because of the fertilizers and pesticides. So together, the environmental stress leads to inflammation, disruption of uh, insulin signaling, and oxidative stress. Leads to further chronic diseases like diabetes, obesity. But these diseases are, of course, very common and there. But what is subtle changes which happen? And nowadays, you will know more and more about the subtle changes in your gut which are happening, which needs to be addressed before you go ahead with the complete treatment. And this can be done by, the main 6 to 7 aspects of the treatment. That you have to first look at the leaky gut and GI function. You have to understand what is the sensitivity you have, what is intolerances you have. That is also very important part of your treatment when you are treating chronic inflammation. Along with that, you need to know what is your immune response towards that problem which you have sensitivity or intolerance. Then identify and rectify the problems. At the same time, you have to improve your nutritional deficiency, and you have to dampen your inflammation. Now here, dampen your inflammation and your detox, where ozone therapy comes very handy. So before we go ahead for ozone therapy, you need a proper hydration. If you want to have good immunity, I think hydration is very important. And the second most important is oxygenation. And that is always overlooked. People don't really look at oxygenation as the treatment, whereas ozone is completely oxygen-based therapy. And when you take ozone therapy as a detox and a healing modality, you will get a better outlook towards the world. And this is a beautiful picture which I can see. With the ozone, you can see the world better. The other thing which I would say, ozone is naturally used as a sunscreen by God. So if it is an ozone layer which is there in our atmosphere, is a natural sunscreen, you don't really need a sunscreen. There are certain harmful UV rays which can lead to skin diseases and skin hyperpigmentation of melanocytes, or you can have hyper sensitivity towards the skin. That is naturally covered, or that is naturally filtered by an ozone layer. So when you have a natural sunscreen as ozone in the atmosphere, you don't really need to be worried about the sun's rays, and you don't need really the sunscreen. So I would say here, one, vitamin D, you're taking as prevention. That, as doctor, I love that sentence, that if you have good vitamin D, no sunscreen is required internally. Similarly, if you have a good cover of ozone in the atmosphere, you really don't have to worry about blocking your skin with the sunscreen. So ozone, which is a natural protector for the earth environment, but how we can use that for our own body, we will see. So when you give ozone therapy, it is an extra oxygen molecule which is attached to O2, and that makes us O3. When you're giving this, it's a combination of oxygen and ozone according to the disease which you need to be treated. Now, in case of autoimmune conditions, there are the conditions where you need to do ozone therapy in a very subtle way, like a very gentle protocol, and in a certain autoimmune conditions, you have to have a very advanced or germicidal property also you require. So when you give ozone therapy, it will lead to oxygenation and oxidation depending on the dose, which is very important. And ozone therapy has been practiced across the world. You will see the presence of ozone therapy widely accepted in Europe, also in South America, USA also. India, as you see, Ozone Forum of India is representing Indian doctors for ozone therapy world. And we also have it in Japan, China, Australia, and many more. There is a growing interest of knowing how ozone therapy has been working in chronic inflammatory diseases. And ozone therapy was the first paper on ozone therapy was published in 1911, which was in Lancet Journal, which is the highest rated journal on insomnia, pneumonia, whooping cough, diabetes, gout, syphilis. So there are multiple uses. And the main biological property of ozone therapy, when you give ozone inside your body, is that it maintains your cellular redox balance. That is, that it protects the body from oxidative stress by stimulating your intracellular antioxidant defense mechanism. And if you have better antioxidant defense mechanism, the disease can be tackled better. Along with that, ozone has a very powerful germicidal property. So if you are taking ozone therapy, you will have to be less dependent on your antibiotic or on the antimicrobial therapies. At the same time, ozone therapy improves your immune conditions or any immunity deficiency condition by immune modulation. So here we talk about immune modulation, neither suppression nor stimulation. Immune modulation means that we upregulate the body's system and we bring it to a high alertness where body can differentiate between invader and body can differentiate between hyper immunity also. So ozone therapy has a delicate balance by improving or modulating your immunity. At the same time, it improves your metabolic regulation and oxygen metabolism. So you have a better circulation, which improves better oxygenation and metabolism. So when you give ozone, so you must know that it's an oxygen-based gas therapy. It is a medical gas therapy. And when you give inside the body, it will dissolve in the plasmatic water and have early phase and the late phase. Early phase where we were talking about immune modulation, oxygen supply to the body. At the same time, it releases autocoids and growth factors. So your healing is faster. Your skin, your wound, anything, and any stress of your body will be healed faster when you do ozone therapy. At the same time, it improves your nitric oxide balance. So modulation of nitric oxide will also enhance the circulation. It improves your body's own stem cell capacity. So you have a better metalloproteinase, so which enhances which gives you a super gifted erythrocyte that improves the better circulation, not for only that time when you're taking the treatment, but it also the result stays for at least 3 to 4 months after the ozone therapy is given for 15 to 20 sessions. So in general, when you take ozone therapy, it will improve tissue hypoxia. It will reduce the inflammation. It will have immune system modulation, oxidative stress reduction. It has infection control, you can control the viral and bacterial replication. It improves your metabolic control by improving your glycolysis. It works on chemotherapy also. There are many times in a lot of psoriatic or a lot of skin autoimmune conditions, chemotherapy is what is advised when they give treatment. It balances the gut flora re-equilibrium. It reduces the dental foci treatment, nitric oxide synthesis, fatigue reduction, healing is improved. So in general, ozone therapy brings the well-being in the patient. We can treat many conditions, of course, vascular diseases, infection, but the inflammation and immune disorder is the key of getting the faster results and chronic oxidative stress disorders and cancer. You have multiple ways of giving ozone therapy, but here I want to emphasize more on rectal insufflation. Why? Because rectal insufflation improves your gut dysbiosis and improves your detox. Through activation of enzymatic antioxidants, ozone improves your antioxidant defense mechanism. Also in immunocompetent cells, ozonized blood releases interferons in IFN beta, IFN gamma, and interleukin A, 1A and 1B. This improves your general anti-receptors to TNF alpha. It regulates your immune disbalance and affects the proper lymphocyte function. So when you give ozone therapy, it does not only regulate your the TH1, TH2, just uplifts the both and brings the equilibrium in the body that improves your immunity, and that's how it helps in autoimmune condition. So what is our protocol for autoimmune conditions? So for autoimmune conditions, we work on eliminating waste, regenerate your liver, reactivate your immune system, restore enzymes, mineral, hormone system. So now one very important is eliminate the waste and regenerate your liver. When we do rectal insufflation, you can get this very fast. It also enhances body's ability to eliminate toxic residue accumulated in the body environment, and that leads to tissue or cellular detox. So what do we do usually? We do rectal, ear, and vaginal insufflation. That is the primary non-invasive therapy. We can also work on minor auto, where you can have your cell-specific antibodies generated, which is very important in improving your Th2. Minor auto chemotherapy, intramuscular injections, local injections for pain management. You can also give, like many a times, people have psoriatic arthropathy, people have psoriatic pain. That can be also addressed by ozone therapy. And you can use ozonated skin products like Skin Blossom, which will hydrate, nourish, at the same time oxygenate the cell tissue, which will improve your general skin condition exteriorly. So when you are treating any autoimmune condition on the skin or any other body, you need a systemic application as well as local application to balance the whole thing. So this is how the gut, when you are giving a certain measured amount of ozone oxygen mixture in the gut, it improves your gut dysbiosis. At the same time, it upregulates your liver, and thus the liver metabolism also improves. So advantages of rectal would be, it has parenteral systemic effect. It works very easy for children as well as adult. It is a very easy and fast delivery. Very important, is a wonderful tool for gut detox. Economical, no needle prick. You really don't need hours and hours together for any therapy when you're doing ozone therapy. It works on liver, which is very important because liver metabolizes everything what you eat, everything what you consume as a medicine, everything what you are taking supportive, anything. If you have better liver function, you have better immunity and better health. And this is how, when you take ozone therapy, It will balance the gut-brain axis. It will improve, reduce the gut dysbiosis. That reduces the skin condition or improves your skin condition. So let us take the pictures, because we need to, I think, take the Q&A also. So this is the psoriatic patient. We have treated him with rectal and something called bagging, and also along with that, the skin blossom treatment. We also treat a lot of other skin conditions like herpes zoster, infection, herpes simplex. After that also is used. Verrucas is also one of the autoimmune conditions where hyper, pigmentation and hypernodular condition, which can be worked. Lichen planus is also another autoimmune skin condition, which can be addressed with ozone therapy. In the beginning of the treatment and after so upper, you see there are so many patches of lichen planus, and by the end of the treatment in 2 months, they had improved. Beginning and the end of the treatment, it works and this is Dr. Jignasha Captain's patient who was taking ozone therapy for Grover's disease. It is an autoimmune skin condition in the spectrum of psoriasis only. His face was completely charred, and with rectal insufflation and minor autohemotherapy, he was so happy that he can go out without the face cover. And that is how we are helping patients. You'll be happy to know, Renu, that before we came about knowing about mega dosing of vitamin D3, but somehow, somewhere, I felt that vitamin D needed to be corrected. And we always gave them, not every day, but we gave them the correction of vitamin D along with ozone therapy, unknowingly to this thing. So I always looked at vitamin D and B12 correction as a mandatory for any treatment when I gave, being it RA, being it any pain condition. It was since 2007, I used to do this unknowingly. Good that now I know the reason why it is working so beautifully. But ozone therapy was also one of the bigger push in getting the functions of your body regulated and improved. And it re-equilibrates your physiological activity. So if you have a torn and tattered, condition, take ozone therapy, take vitamin D, and you can rebalance the best way of your, existence. And that is how you must have a culture of wellness instead of looking at wellness as, okay, if I fall sick, I will look at it. No, look at it now. It is, you have only one life and you have to live with your body. So that's how. Thank you very much. And thank you for inviting me to talk along with you. Thank you. You are muted.
Thank you so much, Dr. Millie. Very nice, very enlightening. And all the fundas got so beautifully brushed up and revised, and you did a great job. And she's doing an amazing job. She trains doctors pan-India, and I don't know how many batches she has taken. She has trained so many doctors into ozone therapy. And friends, I will definitely like to tell you, don't despair by the word rectal ozone. Well, even I have taken it, and it's a great experience because the way it cleanses the body, the feel, it's, the way we cleanse our home, it's worthwhile cleansing our interior. It is something like that. And it is a very simple technique. And there are so many doctors in India trained by Millie that I'm sure, Millie, maybe you can later suggest how they should get to know who is the doctor in their city. So maybe either some method you can say, or you have a directory or something. So
no, so on our website, that is ozoneforumofindia.com, under contact us section, we have listed all the practicing doctors. So anyone who requires can go on website called www.ozoneforumofindia.com. And in contact us section, you can look at region wise, like from Maharashtra, from Gujarat, from wherever you are. You can find the doctor who's practicing ozone therapy. And I think we have created that much awareness that every doctor will correct your vitamin D to a little extent. The rest you can manage.
That we can manage, because we are doing it online also. So you need not come to meet us in Pune, right? We have patients from Pan India and from other countries also, and we are managing it online with a very systematized and a very effective system. So thank you, friends. It was good to have you all.
Thank you.
Wish you all the best. Best of health. Thank you, Dr. Millie.
Thank you.
And thank you, Mayur, being backstage and making all the things happen so smoothly. Thank you very much.